A bipartisan group of state lawmakers are looking to expand Medicaid benefits for new moms. A bill introduced this past March would extend coverage for low-income new moms to 1 year after giving birth. Joining me now is Republican Senator Joan Ballweg, one of the co-authors of this bill. Senator, thanks for taking some time to be here.
Very happy to be here and talk about something I'm very passionate about.
Let's talk about what is in this bill. So who exactly would be eligible for extended coverage under this legislation?
So currently we have a better benefit for pregnant women and women 60 days postpartum at 306% of the federal poverty limit. And what this bill would do would extend that for another 10 months, so they'd be 12 months postpartum. So that would affect approximately 5,300 women, so that would get that extended benefit.
And how would this legislation help these women and their families?
Well, we unfortunately in Wisconsin and across the United States have a terribly high percentage of folks that are suffering postpartum maternal mortality, maternal morbidity issues, and a high incident of infant mortality also. For an industrial nation and something that we're very proud of, our health care coverages here in Wisconsin, this is very troubling. So we're hoping that by this extension, that many women that have things that have been exacerbated by their pregnancies or have popped up and sometimes don't even show up until several months postpartum, such as postpartum depression, hypertension, those kinds of things. If we can keep these new moms with the healthcare provider that they've had since they were pregnant to manage their healthcare concerns, that we can have mom be healthier and have mom be there for baby. And it's going to be good for both.
So as you said, you are passionate about this legislation. This is not the first time you've introduced it to the state legislature. Last session, it didn't get a floor vote. How is it progressing this session?
Well, last session we introduced it kind of late in the session. We had a great partner in the March of Dimes. This year, as you said, we introduced it in March already. We have 73 legislative co-sponsors. We have 45 groups that have registered in support, from insurance company and healthcare providers to the American Heart Association and March of Dimes again. So we have so much more understanding, I think, of what the benefits would be, not only for these individuals, but long term in actually saving money for the state in being able to take care of some of these chronic conditions and keeping these new moms either in the workforce or get them back on their feet so they can get back to what they were doing before they became pregnant.
So let's talk a little bit about the sentiment of this kind of legislation. Republicans in the Wisconsin legislature have historically been against extending Badger Care Plus coverage this long, but across the country over the last year, other Republican-led states have been softening on the issue. There have been several states over the last year who have passed this extension. How do you think that impacts your bill's chances?
Well, hopefully very well. Currently we have 41 states plus the District of Columbia that all are doing this. This passed the state Senate earlier this month, 32-1. So we're hoping that with all of the support that we have from legislators individually, from all these organizations working together, we can move this through the assembly and onto the governor's desk.
How do you get it across the finish line, Senator?
Well, that's just it. We're encouraging. I'd like to encourage anyone who is passionate about this and can see that it is going to be a benefit. All these organizations that have come out early to say that they are interested in doing this for the people that they serve. Encourage their state representatives that have already signed on or maybe need some more information to say that, yes, we do think this is something that is important for Wisconsin, important for Wisconsin moms, and hopefully we'll have that movement in the state assembly.
So as you mentioned, 41 states plus DC have passed legislation similar to this. A lot of the sentiment changing post the U.S. Supreme Court overturning Roe v. Wade. It has kind of changed the way Republicans talk about pro-life, abortion rights issues. And I wanted to ask, Senator, so far this year, multiple states have had abortion rights issues on the ballot, and even in deep red states, and each time voters are in favor of protecting them. So I wanted to ask, would Republicans in Wisconsin consider putting abortion rights to the voters here?
Well, we certainly don't do those kinds of advisory referendums typically here in the state of Wisconsin. I think what this bill is doing is just showing our support for families, no matter what income level they're at, knowing that we need to do more for those folks are most impacted because they are, at a lower income level. Make sure that we have happy, healthy babies and moms to take care of them. This is part of what I've done for many, many years in working to strengthen families and be more aware of taking care of our youngest as they grow. There is so much that we need to do to make sure that they are supported, and this is why I'm moving this bill forward again, and really I appreciate your help in getting the word out, and hopefully we can get it through the Assembly and onto the governor's desk this session.
Well, Senator, we'll be watching progress of this bill through the legislature closely coming up towards the end of the session here into next year.
Thank you for the opportunity.
Thanks for being here.